My name's call me Eliud Morimori Chichi. From 1992, 93, 94, 95, 96, 97, 98, I didn't know it's TB until when I went to visited Potter's Hospital. They did a chest x-ray. After 30 minutes, I got the results. I took them to the doctor in charge. He went through and told me that I had TB. I remember Dr. Muse coming to me and talking to me saying, Eddie, I have bad news for you. Then I asked him, what are the bad news? He said, you are resistant to all the 3 TB drugs. So I was on treatment, on injection for 11 months. I was on treatment for 24 months again. So 2014 is when I completed my treatment. It's free to treat TB, yes. But on the process to treat TB, don't forget there are some tests to be run. You will be asked for an CT scan. You understand? There are some supportive drugs you have to buy. So I can say it's free. Drugs which are free, it's only RHZD and streptomycin injection. Other supportive drugs you need to buy. Kenyans should stop this issue of, because they stigmatize themselves, you understand? They fear going to the hospital. Why? Because Njoroge or Tieno or Mama Wangare or Fatuma will start saying you have HIV positive. Think about yourself, man. There's nothing as good health.
Very well, that is just a sneak preview of what we are discussing right now on Your Health. Of course, one of the TB survivors, someone who has gone through the experience, telling his story, and of course saying that in as much as the government is saying that a TB treatment is free, it's not as free as you think. Those are just his sentiments. And indeed, it's time for us now to get to have this discussion. And now joining me in studio is Evaline Kibuchi, who is the Chief National Coordinator, Stop TB Partnership in Kenya. Thank you very much for joining us this evening.
Thank you very much.
And I just want to pick up, from his story. That is just a case in point. But what do the figures look like? That is a face behind the TB. What are the statistics like?
Thank you very much. I would want to start with how TB looks like globally before I come down
Locally.
to Kenya.
Yes.
Yeah, tuberculosis overtook HIV as the leading infectious killer globally. Mm-hmm. That was in 2014 when, in that year alone, we lost 1.6 million people globally. That figure was much higher than what HIV had claimed in that particular year. Mm-hmm. And this necessitated WHO to declare TB as the leading infectious killer. Mm-hmm. Coming down to the country, Kenya is one of the countries that they're listed, it is listed among the countries globally that have the highest burden of TB.
Oh, TB.
And in Africa, we are listed number 4 after South Africa, Nigeria, Ethiopia. We follow there.
How many people are we talking about in terms of figures in Kenya?
In Kenya,
how many people, perhaps die as a result of TB within a year?
Yeah, if we look at the current statistics, we lose about 60 people to TB per day.
Per day.
That's about 300,000 people in a year.
Mm-hmm. That is how bad the situation is. And what really is causing this? Why are we seeing a huge number of people dying as a result of TB?
I would first want to look at what are the factors that predispose us as a country to be that high burdened with tuberculosis. One of the predisposing factor is just the socio-economic status of our country, poverty, because TB thrives best in congested places,
yes,
places that are not well lit with natural lighting, among population that are malnourished, and where we have high HIV statistics or prevalence. Mm. So if you look at those factors, Kenya is affected by those factors. Mm-hmm. So basically, I would say the socio-economic status of a country exposes that country to have high TB burden.
Mm-hmm. What about diagnosis? Is it that people don't get, the treatment in time, or what really is stopping them from accessing the treatment? Because the government says that treatment is there.
Yes, let's look at, the government will say treatment is free.
Yes.
Which is free, that is the treatment itself. But the process of diagnosis before you are told now you have TB so that we can put you on treatment is the most difficult one. We find that most people have gone to so many different hospitals before finally they're confirmed to have TB. They will have visited maybe a herbalist, a chemist, a private hospital, and finally they go to a public hospital where now they get the free treatment. And diagnosis is not necessarily free because an X-ray is not free. And even when people are put on treatment, there are a lot of costs that come with treatment. For example, the out-of-pocket costs, the transport to and fro hospital, because when you have TB, you have to frequently go to hospital first to be checked, to be frequently tested, and to get treatment. And because of how TB affects one's body, we find so many people are so weak that they end up losing their jobs. So we have had people who have lost their jobs, people who have even taken loans to take care of TB medication.
What about, the stigma that comes around it? Because just like we were watching, he was saying that, at some point he even thought he had HIV, sort of like the similarities between TB and HIV that make people have, that stigma in the first place not to even go and seek medication.
Stigma in TB is higher than HIV. Why so? Because when you have HIV and you're on treatment, physically no one can tell that you have HIV.
Yes.
But when you have TB, you have lost weight, you're coughing, you're sweating at night. So those physical symptoms of TB make people fear going to hospital because there is this, first of all, you look sick. Secondly, the notion that anytime you have TB, you have HIV makes people fear to go to hospital. But I would want to clarify this notion that it's not necessary that when you have TB, you have HIV. In Kenya, for example, nationally, only 30% of the people with TB have HIV. 70% of TB patients do not have HIV. So we would want to clear that notion. Do not fear to go for a checkup because you might have TB, you might have HIV.
So what are the initial, symptoms that would make me want to go, and get tested for TB? What should I look out for in the first place?
The symptoms for TB, the most common TB, which is a TB that affects our lungs, or what we call in English the pulmonary TB, are as follows. 1, a cough, and we say a cough of any duration. Don't wait for 2 weeks, don't wait for 3 weeks, any cough. Night sweats, and when we talk about night sweats, we talk about sweating until your sheets, look like they're soaking in water. Loss of appetite, pain in the chest, and loss of weight, and that is drastic loss of weight, not just loss of weight.
Not the gymming weight.
Not the gymming weight.
All right. Let's talk about, perhaps the treatment in itself, because there are those that go for 6 months, 1 year. How is it that someone is able to bear this particular cost?
Yeah, there are different levels of tuberculosis. The first level is what we call the normal TB, whose treatment go for 6 months. There is a next level, which is the drug-resistant TB, whose treatment go on anything between 9 months to 20 months. The difference is in the types of treatment. A few years before, we used to have treatment that went for 24 months.
That is 2 years.
That is 2 years. And it had injections for 6 months.
Every day?
Every day for 6 months. And a pill burden of, they talk about up to 18 tablets per day. But right now, we appreciate the fact that now we have a shorter type of treatment, which goes for only 9 months, with only 4 months of injections. And we also have now even better news that now we have treatment that will be going for about 20 months with no injectables at all, and they have less side effects. Talking of side effects, we have listened to Chichi's story, and what he has talked about side effects of tuberculosis, the drug-resistant TB that he suffered from, and also the complications. That
his was a multi-drug resistant TB.
His was MDR TB, and the complications that came after the treatment. So the side effects of the treatment that we've been having for drug-resistant TB include loss of hearing. And we have quite a number of patients that have lost their either partially or completely. And that now calls for more expensive treatment because you'd have to look for treatment for the hearing loss. You'd need the hearing aid, which, as it were, the NHIF package does not cater for medical equipment. Therefore, you need to go out of your pocket and buy the hearing aid. The case of Chichi, he requires an oxygen concentrator machine. That means he survives on external oxygen. That machine he has to buy. The NHIF will not cater for that because of medical equipment. So that's why now the catastrophic costs that affect TB patients come in.
What are we talking about when we say costs? You know, just an estimate in the event that you get infected with MDR TB. What are you looking at in terms of spending?
Yeah, a study that was conducted in 2016 indicated that for a normal TB patient, it will cost him about 26,000 over and above what the government covers. That is in terms of indirect and direct costs. By indirect, I mean the transport, the food, and all those other out-of-pocket costs. For drug-resistant TB, we found that they were spending up to 125,000 Kenya shillings out of their pockets. So that's the figures we are looking at.
Why is it that, you know, we suddenly have we're talking a lot about MDR TB. Is it that people don't finish the treatment, or what really has changed? That's why we're talking about MDR and now even XDR.
We need to look at what are the factors that lead to drug resistance. That's where we need to start from. Drug resistance is mainly caused by poor adherence to treatment in the first place.
Yes.
That means you either stop taking your treatment midway, or you take your treatment on and off. That is primarily how we develop drug-resistant TB. But when you get exposed to somebody now who has that type of bacteria that has resisted treatment, then you get infected with that strain of drug-resistant TB. Therefore, we say there is the primary cause of the MDR and the secondary, where you get infected by the already drug-resistant bacteria.
Get infected by the one that already exists. All right, let's talk about what we are saying. We are saying it's time to end TB, yeah? And the government keeps saying TB in a TIBA. What interventions are we looking at? Because we're still talking about people dying from TB, yet there is treatment.
Let's first look at the theme of it's time to end TB. When WHO declared TB the leading infectious killer, they went ahead and put a target of ending TB from the face of the earth by the year 2030.
2030. How terrible is that?
That's about 11 years from today. Yes. So what that means is that the governments have to do things differently. Even at the global level, we have to do things differently, invest more to achieve that goal. But as a country, what are we looking at? What do we need to do to end TB by 2030? First of all, I want to go back to what factors predispose us to TB. Socioeconomic factors. If we look at the Big Four agenda, if they were to be implemented 100%, that would be the surest way of ending TB. But I would say that is long term. In the short term, what do we need to do? First of all, basic practices, opening our windows, whether you're in the house, whether you're in a matatu, because like I say, TB thrives best in a place that is not well ventilated. For those ones who are infected, they need to protect others who are not infected. And how do they do that? First of all, if I have TB, when I'm coughing, I have to practice cough etiquette, like holding my mouth with either a tissue, which I properly dispose of. After that, staying in a well-ventilated place. So if I have TB, I should ensure that I'm sitting somewhere in the open to protect others. And it also helps to tell other people that, hey, I have TB, so, don't get too close.
And the stigma comes in.
If I am talking about it, I think it means I am comfortable with it and I'm telling you to help you. And the most important thing is immediately you feel or you detect one of the symptoms, and you don't have to wait for all the symptoms, just one. Go for treatment immediately, because the longer you stay with the bacteria, the more people you infect. The good thing about TB is that after you're on treatment for about 3 weeks, you cease being infectious. You cannot infect other people. If you've been on treatment after about 3 weeks, though this has to be confirmed by a medical personnel that now you're fine, you cannot infect some other people, but you have to complete the treatment up to 6 months, even if you are not infectious and even if the symptoms have cleared. So treatment, seeking treatment early, that is one of the most important things. And according to a survey, again, that was conducted by the government, it showed that the population that is mostly affected by tuberculosis apparently are men. Men are twice as infected as women.
Why is that?
Maybe they will tell us. I can see them around here. And mostly young people between the ages of 24 to 35 years. So we need to put a lot of focus on that population, and also women above 65 years of age. So when you try to understand why, we found there are very low levels of awareness. That people do not even know the basic symptoms of tuberculosis. So even when they start coughing, they think it's a common cold.
It's going to go away.
They go over the counter, buy some tablets and swallow. So lack of awareness is one of the key problems. And the second one is stigma. There's a lot of stigma, and the first one is self-stigma, where when I feel like I have tuberculosis, I stigmatize myself. I refuse to go to hospital.
Because your first thought is you're linking it to HIV.
Exactly.
And then,
and also other people now stigmatizing me. When you see me coughing, you know, you stay away from me. So I will fear interacting with other people because I fear you're going to stigmatize me.
All right, in Kenya, we're talking about it's time to be, for our TB-free Kenya. I mean, what plans perhaps do we have in place to move towards this particular goal?
Okay, one of the strategies that the government is putting in place, of course, is to look for people who are out there with tuberculosis, are living with tuberculosis, have not been diagnosed, and they are not on treatment. And again, according to that study, we saw that about 40% of people who have TB have not been diagnosed. So what they're busy doing right now is creating other new TB cases. So one of the things that the government is doing is to look for those people who have not been identified, and how are they doing it? It is going beyond the common practice of sitting at a health facility and waiting for people to come and seek treatment. Now the government is going out there, screening people in the matatu terminals, in schools, in prisons, going out where they're likely to find more TB cases. The other one is what they are calling the multi-sectoral approach. That means we want to remove TB from being a medical issue and making it a social issue. And saying that everybody has a responsibility of TB. And I just want to pick an example at random. If the Ministry of Transport, do they have a responsibility in ending TB? Yes. Most of transmissions take place in public vehicles, the matatus, the buses. So we only need the Ministry of Transport to take responsibility and say, we are taking the campaign of opening windows as our responsibility. We are going to put stickers in the buses and tell people, open the windows.
But people are always afraid when you open the window, someone will pass with your phone, your handbag.
Yes, I heard somebody saying that slay queens will refuse to open the window.
There's always that argument.
But it's because of lack of education. I think if we intensify education and create more awareness, then somebody will understand that it's for my health that I need to open the windows. The Ministry of Education, just an example. There has been an upsurge of registration, enrollment in schools, but the infrastructure has not changed. The dormitory that I slept in those years, I don't want to say which year, right now has double the number of pupils or students who slept in that dormitory. Same ventilation, same space, double the number of people. What does that mean? That there is over-congestion in their learning institutions. So the Ministry of Education, again, need to look at it and take it as a responsibility, improve the infrastructure, intensify screening in schools so that if one of the pupils is infected, we put them on treatment and reduce chances of spreading the infection in the schools. So everybody has a responsibility.
All right, what about for the people who are already infected with TB and they're on medication? How do we get them to complete their medication, because like you said, after 3 weeks you're no longer infectious, but then again there's always the perception that you're feeling better after a month or two, and then you're imagining taking drugs every day for the next 6 months, and it's not an easy thing to do.
Yeah, when the patients are being initiated on treatment or started on treatment, they are given education. They are ideally supposed to be given education, but this may not be happening because, of course, we know the shortage of healthcare workforce. But they should be given education to, first of all, be given their responsibility, because they have a responsibility. When I know I have TB, it's my responsibility to protect other people. For example, for the patients who have MDR TB or drug-resistant TB, they're supposed to cover themselves with a mask whenever they are in public or whenever they are with other people, to protect other people. But does that happen?
No.
Have you ever seen somebody walking with a mask?
The stigma that goes with it is a no-no.
Exactly.
Yes.
So that is one of the responsibilities. Number two, it is their responsibility to make sure that they complete the treatment, because failure to complete treatment, one, they are risking their lives, and two, they are risking the lives of the people around them. Therefore, they should finish the treatment according to the doctor's instructions. And number three, we keep telling them, you need to educate other people. I am very happy with Chichi because he has taken his experience with TB to educate other people.
To tell other people his
Exactly.
story.
And I'm sure there's so many people he has saved, because when he tells them, you need to be checked for TB, and they're checked and they're put on treatment. I mean, that's a life saved.
Yes. All right, I'm told we have run out of time, but I'll just give you a minute to look into that camera and perhaps, just speak to the Kenyan people on why it is important for us to stop TB and be a TB-free Kenya, and we're looking at 11 years. All right, that's your camera.
Thank you very much. TB is preventable, is treatable, is curable. It still beats me why somebody should die of a disease that is curable. So I would urge Kenyans that we need to equip ourselves with information regarding our health, know ways of prevention, seek treatment whenever we are sick. Let's not wait. I know most people will first take self-medication, go over the counter before they go for treatment, and by then it's too late. And for the government, I want to say it is the responsibility. The health of Kenyans is the responsibility of the government. Ensure that we have the right diagnosis and they are affordable. In fact, they should be free. The hospitals are well equipped, and there is a lot of awareness among Kenyans. And I would also tell the president, first of all, I want to thank him very much because he attended the meeting in New York and made commitments. I would want him to bring that commitment down to the country and ensure that we have adequate funding for TB. It is possible to have a TB-free Kenya by 2030.
Well, thank you, Evaline. I like your positivity. And of course, obviously, this is where the awareness begins. So we are very grateful for you, finding time to be with us this evening and to shed light. I hope the next time we talk, we'll not be talking about TB being a silent killer. We will have eradicated it altogether. Well, this is where we put a cap on your health. Of course, our guest in studio is Evaline Kibuchi, who is the Chief National Coordinator, Stop TB Partnership Kenya, just giving us some insights on why we should be worried about the increasing cases of TB and how we can be able to bring those numbers down. We end your health segment for now, but Betty Kiptum is up next with the day's business.